Unexplained infertility. So the name itself says that infertility is unexplained, but it is actually a diagnosis of exclusion. Unexplained infertility is when a couple fails to conceive despite of regular intercourse of more than 1 year duration and both the partners' tests come out as clear that we cannot find any cause for their infertility. So this is a diagnosis of exclusion. What is important here is the test should be done in a proper fertility center from an experienced and skilled fertility specialist. Unexplained infertility is challenging due to two main issues. First one, uncertainty about the cause of infertility leaves the couple in confusion. Second one, false reassurance due to normal test makes the couple wait for prolonged time in the hope of natural pregnancy. Let us address one by one. The first one is uncertainty about the cause of infertility. So what a patient can do about this is consult an expert and experienced fertility specialist because just a normal pelvic scan may not be normal. An expert fertility specialist can diagnose deep infiltrative endometriosis or subtle signs of infections like adhesions or even intrauterine pathologies like intrauterine adhesions or polyp on pelvic ultrasound, which might have been missed in previous scans. So it is important that the evaluation happens for the couple completely in a fertility center by an expert fertility specialist so that we can label the reports as normal. Most of the couples who have been labeled as unexplained infertility, we find to have that the patient is having either endometriosis or peritubal adhesions or sometimes pelvic infections. And most of the times the male partner tend to have issues related with the sperm parameters or even increased DNA fragmentation index. So it is important to do the complete evaluation of both the partners by an expert fertility specialist. Second one, false reassurance and prolonged waiting period. If you visit an expert fertility specialist, then the fertility specialist usually makes a plan for unexplained infertility patients. And there also has to be a timeline which the couple has to follow about the treatment plan, because prolonged waiting can actually increase your issues related to maybe worsening of the endometriosis, or untreated infections can lead to sequelae like hydrosalpinx or blocked fallopian tubes, or also it can reduce your chances when you actually go for fertility treatment, because by the time such couple starts fertility journey, the woman's age has already crossed 35 years or they are left with very less egg reserve. So it is important that there should be a plan and there should be a timeline which is given by a fertility specialist to follow. But the good news is unexplained infertility is treatable with fertility treatments like IUI and IVF. According to one NIH study, around 90% of the couples who have unexplained infertility ultimately conceive with IUI or IVF. I hope this was helpful.